sex workers. Somewhere for the last 51 days, this was for the last 48 updates. Good morning, and I'm with my colleague directly we have raised the initiative on the COVID-19 situation, and as of yesterday we did have 15 new cases of COVID-19 that we expect the nation because categorical that during the second last update that Nakonde actually yesterday Nakonde is going to be the area of and according to the images that we were seeing, these actual compliance for the one story that we made yesterday that a lot of businesses have actually, been recorded in our regards to COVID-19, and able to get the statistics but earlier on I had an interview with the Chief Police indicated to me that yes, these cases are large. The only way that the people take the spread of COVID-19 Yes, there are quite a number of so on. While we have imposed a lockdown on our side, Tanzania hasn't done that. So basically, the best thing to do at the moment is for each and every individual to ensure that they protect themselves. And COVID-19 is all about lifestyle. How are we able to include some of the measures that have been imposed? How are we able to wash our hands? How are we able to sanitize our hands? How are we able to observe physical distancing and many other yes, it's very key. And according to the presidential address, this is now the new normal and it's all about you fighting this particular pandemic. Yes, there is a total lockdown, and I feel for me personally it's going to bring out quite a number of cases, and will be able, government will be able to extend that to the virus that will be able to spread. For instance, one that transpired in Kafir was recorded, many cases of the crime actually recorded. So a 24-hour lockdown is allowed people to screen, and the results, according to statistics that we are now receiving from the country, needed to the work results. Now we are receiving cases in country. If there are some cases that are coming to 1 to individuals, and the hope lies now in that point where we'll be able to see a situation where cases, only a few cases, but overall, what is important is for people to agree to the nature of
was ready for the testing that will take place and the partial shutdown that will be experienced today. So people in the country were advised to stay put and not panic. But today we'll get an update on what did happen.
Good morning, countrymen and women and members of the press, and welcome to today's press update on the COVID-19 pandemic. The government of the Republic of Zambia, under the leadership of His Excellency Dr. Edgar Chagwa Lungu, places public health security as a top priority. And to this effect, the Republic of Zambia, through the Ministry of Health and its Disease Intelligence Wing and its partners, in a one government approach, the Zambia National Public Health Institute continues to safeguard the health of our citizens by scaling up and strengthening our public health security interventions. Zambia is facing a COVID-19 outbreak, and under the stewardship of President Edgar Chagwa Lungu, a response plan has been mooted that is being revised on a daily basis, informed by data, informed by other variables in the pandemic. So today, we report on what transpired in the last 24 hours. Nakonde was defined as an affected area and the epicenter, and the exercise of screening and testing in Nakonde is ongoing. So Nakonde continues to undergo the exercise of screening and testing. His Excellency President Lungu yesterday closed down temporarily the border to facilitate implementation of public health interventions that are of high impact and that would help us stem the pandemic in the area and beyond. Today, we have deployed human resource into Nakonde. We have deployed personal protective equipment. We have commenced disinfection of public places, and we have intensified testing for case finding. So active case finding is taking place. We have continued to validate the samples and the results from Nakonde, and we will update you once the process is finalized. Reporting on the 286 samples that we've tested countrywide, and particularly tested in Lusaka, we have not recorded a single case of COVID-19 in the last 24 hours. And we are continuing to process the samples and validating the results from Nakonde, and like I said earlier on, we'll update you as we complete the process. For the 286 samples that we did through our mass screening and testing in various parts of Lusaka, we have not recorded a single case. If we look at the people that we've been monitoring and quarantine, these are 3,741 persons at high risk that have been discharged from the mandatory quarantine. Our surveillance teams would like to appreciate the alerts from the community, and we managed to respond to 1,866 alerts, and these have been cleared as non-positive. The global picture, 4,181,218 cases, including 283,877 deaths and 1,493,492 recoveries. Africa recorded in 24 hours 2,760 cases, 66 new cases, and the number of cases cumulatively has risen in Africa to 64,752, including 2,301 deaths, while 22,683 have recovered. And this data is at 7 a.m. this morning. Members of the press, fellow countrymen and women, allow me to reiterate the call by His Excellency President Edgar Chagwa Lungu to all of us to ensure that we adhere to the stipulated COVID-19 response measures in order for us to fight COVID-19 successfully. Let us avoid touching our mouths, eyes, and nose. Let us rather maintain high levels of hygiene, washing our hands, observing physical distancing, and avoiding crowded places, and exercising regularly with no handshaking. Let us ensure we stay home and only move when it is essential, and let us mask up when in public. The measures that were announced and put in place, and as announced in the presidential address to the nation, remain in effect. If we look at our figures cumulatively, therefore, we still remain at 267 deaths, 267 cases, with 7 associated deaths and 117 recoveries. Let us continue to focus on health holistically, and remember that our health system strengthening agenda is firmly on track, and let us not forget the importance of maternal and child health, HIV, AIDS, malaria, and TB, and let us continue to work together to respond to the needs for universal coverage. Thank you.
Thank you so much. Thank you so much. That was an update by Minister where we recorded 0 cases in the last 5. I now open up the floor for any questions from the members of the press. Any clarifications that you want the minister to make? Yes, Dr. Brian Murray, Shimunya, and this one too, and certainly.
Good morning, Minister. Good morning, the High Table. This is from Saka showing some glimmer of hope that we might be winning the fight. However, Minister, just a few clarifications. One, I want to make a follow-up on the Nakonde issue. Most mining firms and industries use the Nakonde border to bring in key essentials in terms of mining and also other raw materials. I just want to find out if at all there is a stipulated period for the closure of the border, and also some colleagues trying to find out within the mining industries are also concerned. They want to find out if at all there's some form of exemption as to which materials can be allowed, or it's just a total closure during this period. Secondly, from the 3 COVID-related deaths recorded on Saturday, and also the Kafue incident, I think I would not be so far from the truth to assume that we could have had other cases, COVID-related cases, deaths that have gone undetected. Therefore, I want to find out if at all government has conducted any form of assessment or comparison of the average mortality rate for the first quarter or the first 4 months, the average for the past 2 years, in comparison with the first quarter or the first 4 months of this year, just to ascertain if at all there could have been some COVID-related deaths that went undetected, and maybe to what extent. Thank you.
Thank you. Patience Mwaka from CTTV. Just a clarity on the evacuees from India, those that came in and those that are to come in. I think that's between the 11th or 15th of May. There's those that cannot afford to foot their bill for quarantine. So what is the government planning on doing for those that cannot foot their bill for quarantine? Thank you.
Good morning. I'm Chumana from Ghana TV. Honorable Minister, you did indicate that for Nakonde there's been what we can simply call the temporal lockdown, ensure that everyone is screened as well as tested. But we do understand that for the other part, which is Tanzania, business has continued as usual. What are the negotiations between the 2 years of states, President Kalungu and the President of the other part of the country, knowing that if business continues for Tanzania, meaning everything that Zambia is doing, for me, it will remain work in vain. Thank you.
Do you have any other questions? So, Minister, for this round, those were the questions. I call upon you to questions.
Well, thank you very much indeed. Cross-border collaboration remains key to public health security. You know, diseases know no borders. So we do collaborate with our colleagues in Tanzania in public health. And remember that Tanzania is a member of SADC, and Zambia is the anchor for the Africa Center for Disease Control. And so we do coordinate at technical level and even at higher level. So we are in cross-border talks with our colleagues in Tanzania over the public health security that is affecting both countries. Secondly, when we receive any case coming to our facilities, one of the protocols that we focus on is swabbing or swabbing and testing for COVID-19. So what we report on are only the positive cases, but there are many that come out as negatives, and we have not reported on those tests. The routine testing that happens at the University Teaching Hospital at a common public health facility involves COVID-19 testing, and what you get to hear are just the results that are positive. And the other thing that you also ought to know is that if you bring any patient into the hospital as a BID or protein gate, by protocol we'll swab them. And so the number of deaths that we are reporting today are the number of deaths as we have seen going by our protocols. In terms of research, we always compare deaths in this period this year with deaths in the same period last year and maybe the other year. So far we have not seen any spike in deaths, and that tells you that we have not seen any worsening yet, and hopefully not to happen. So far we have not seen any change in terms of deaths. For those who cannot afford to be quarantined at their own cost, there are so many people who've quarantined at government cost, and that is not cast in concrete, so there should be no worry about those, because government does pay for those who are in quarantine if they do not have resources. The temporal closure of the Nakonde border is informed by the daily evolution of the data of the pandemic. Therefore, we said we are going to intensify case finding in the area, manage those cases, make sure that we manage them from identified areas, being in Nakonde and in Chisali. We said we would disinfect public places and make sure that we make trade safe. So, by closing the borders temporarily, we're taking our multi-sectoral teams. Remember, you have police, you'll have immigration, you'll have ZRA. The statement that was made on the staff that were infected was a zipped statement. Staff dealing with immigration. Some are policemen, some are ZRA staff, some are immigration staff. And the disaggregation of the data is something that is done, for the purposes of the people on the ground. So we are saying these multi-sectoral teams need to be, one, reoriented in public health security, in the use of personal protective equipment. We need to escalate the level of PPE use in those areas and make sure that by the time we reopen, the staff who are dealing with immigration and migration, the staff, and I mean the whole staff, whether ZRA, police, agents, and so on and so forth, will be dealing with people coming in or going out without putting their lives at risk. So that is an important thing. Disinfection of the border itself is extremely important. Putting in place measures to ensure that there is no importation of the COVID-19 is extremely important. So the closure will be informed by the activities that we've spoken about. But like I said yesterday, Nakonde border is a busy port of entry for Zambia and speaks to our economy in many different ways. And therefore, there are certain exemptions, movement of trucks that are carrying fuel, for instance, that are carrying drugs. There are mechanisms that have been put in place together with our colleagues in Home Affairs, for instance, to ensure that such are escorted and they deliver before the drivers go into quarantine. And then they are also tested. And those who are tested and are symptomatic are released much earlier. However, it's important to note that the period of closure for the border will be informed by the evolution of the pandemic. And secondly, I want to assure you that through a technical lens, through a watchful eye, President Kachagwa Lungu is monitoring the pandemic seriously, and we will be scaling up or scaling down interventions based on the information. Nothing is cast in concrete. The decisions that are made will be determined by or will be informed by the data that is adduced. That's why the President on a daily basis reviews the situation and makes decisions whether to upscale or downscale the response.
Thank you so much, for all of your questions. We still have questions for this. Okay, please go ahead. Any other? Should walk in. Okay. Okay. You have all that well.
Good afternoon. I'm William from Spring TV. There have been some complaints from health workers about, with regards to inadequate PPE. Is government putting in place stringent measures to ensure the safety of our frontline workers, and how frequently is PPE being procured? My second question is, what long-term measures do we have in place as to how we will adapt to the new normal in various sectors of our economy? Thank you.
Could you repeat that question?
The second one? Okay. So what long-term measures do we have in place as we adapt to the new normal in various sectors? Thank you.
Kuchong again from Dama TV. One of the means there is something circulating on social media that about 26 health workers from Angola were isolated and were tested with 4 having tested positive, while the other are waiting for results. Any confirmation to that news data? The other question I did not want to ask earlier on, in fear of maybe being caught paranoid, but the issue of recruitment, Honorable Minister has dragged even, or despite the President stating that it was an emergency. Maybe if we have not recruited now, would you be able to give us a specific time when you would ensure that you recruit, or maybe you already have enough healthcare providers? Thank you.
Do you have any other questions? Minister, those are the 4 questions, please. Call for interest.
Chimunya, why are you accusing yourself of being paranoid? First of all, when we were doing the World Press Freedom Day last week, I was following carefully what the journalists and communicators and other stakeholders, press, were saying. They wanted to be distinguished from social media bloggers. And that is not the journalism that you've got ethics, that you've got, minimum standards and so on and so forth. And you really wanted to be distinguished from those. I don't know, is this a reunion now, or you didn't mean it? But how come today that is becoming your credible source? Your source of information is here, and we'll give you data that is accurate, that is validated. And if we isolate people, we'll tell you we isolated people. There are surveillance activities that will not report, but we'll tell you when we get the actual results from the surveillance information. And so let us just work together to ensure that we feed the public with credible, validated information. All we pledge to you is transparency, as we find no value in messing up with figures. As we talk about a recruitment of health workers, all the letters from PSMD have been received, and people are being called in to collect letters. Remember, to ensure that we don't allow crowding, applications are being done online. Similarly, letters are being given to individuals that are being called, and so all these letters that have been coming from PSMD are now being issued, and this is being done through calling in. So far, we have received from PSMD already letters that we are issuing out, 1,700, and we also know that 2,244 in total have been processed, and so about 1,700 are being dished out, but in total 2,244 have been processed. The IPC, infection prevention pillar, is extremely important in the fight against COVID-19, and this is the reason why we are retraining and reorienting our frontline staff in the multi-sectoral response to ensure that there is minimum possibility to be affected by COVID-19. We continue to stockpile PPEs, and we continue to distribute PPEs to the front line to ensure that the front line is protected.
Thank you so much, that was the question. The measures around the new normal. The new normal,
Well, the term new normal must be understood to mean that we are faced with this pandemic of COVID-19, and the COVID-19 pandemic has been with us for more than a month, and we project it to be with us for some time to come. So we need to reset ourselves to a new way of doing things. We are now wearing masks. That is a new norm. We are now ensuring physical distancing in public places. We are washing our hands more regularly, and we are attending public gatherings that are aligned or certified through the Public Health Act. And there are certain places that we are not even visiting because they are not operational. And yet, there are some places that are cautiously being reopened, subject to the Public Health Act, regulations, and certification. So we are resetting to a new way of doing things, and that's how it should be understood. What long-term measures are we putting in? It's you and me to ensure that we comply and defeat COVID-19 and return gradually to normalcy.
thank you so much. That was the last in this series. Do you have any other questions? Madam, you can answer. Do you have any other?
those that have been recruited or that are being recruited, because there's a lot of questions on when you're going to publish the names in print media of those that are being recruited or that have already been recruited. Thank you.
Yeah, yeah, that's it.
Yes, please.
I just wanted to find out if we have enough bed space looking at the search and the numbers that we're requiring to handle.
Okay, do you have any other? So that was about this one. This one I think we only have two. So
Well, thank you very much. You're right. We are in the stage phase. We expect to see numbers increasing. We have expanded our capacity to test in the laboratory. We have improved our human capital capacity to ensure that we have armies of contact tracers when we find the positives, and we've ensured that we heighten our risk communication, working with you, the media. And therefore, we expect numbers to go up because we are in the stage phase, and what we are doing is simple. Find the cases, detect them early, isolate them, and manage them well. As you isolate them, you're stopping community spread. You therefore see at a point that the cases will start going down, or they'll peak and then taper, they'll plateau, and then the cases start going down. And the moment we start seeing that, then we know that we're now on the winning trajectory. And therefore, that metric of new positives is very important metric or measure, or principle to use, even as you cautiously, look at the various aspects of, the activities around us. So it's extremely important that we improve our capacity to track, to find the cases and isolate them. And we must state today that we are in the stage phase. And while we're in the stage phase, we are saying we will continue seeing numbers going up until we peak, plateau, and then start going down. That will be the natural progression of this. Do we have enough PPEs? Yes, we do. Have enough bed space, you said? Do we have enough bed space? We have identified various structures where we would quarantine people, and there is a criteria on who you quarantine where, on who you isolate where. So in Muchinga province, for instance, in Nakonde, we've already identified places where we are managing cases, where we are quarantining people. Chinsali is another place. The Chinsali General Hospital is the main facility in Muchinga where we are isolating and managing cases. It has a bed capacity of more than 250. And if we look at the capacity for isolation within Nakonde, it's also more than 200. We continue to increase on that space for quarantine because there is mandatory 14-day quarantine, and therefore we will continue creating more space for quarantine. The planning process includes just that process of identifying quarantine areas. It's key as we talk about finding the cases, and there's talking about isolating them, even isolating those who are suspects. Yeah.
Thank you so much, Anna. There was a clarification on whether we're going to publish the names.
Well, like I've said repeatedly, some matters are purely administrative. You, the human resource experts, will tell us if publication of names of people that are recruited is an imperative, and if it should be done, it will be done. But I will shy away from the granular administrative details and remain strategic. The President ordered recruitment of staff. 2,224 letters have been processed, 1,700 ready for issuing, and people being called, and the rest of the administrative staff will leave it to the relevant administrative people to handle.
Thank you so much for those answers, Minister. We seem to have exhausted questions and clarifications from our members of the press. As we hold these updates from the Minister, we still continue receiving donations from well-wishers who are joining the fight against COVID. So today we've got 4 donors, the Judicial and Allied Workers Union, the Women of Excellence, there is an individual by the name of Patrick Moore, and we also have First Quantum Minerals. So at this point, I would want to call upon the representative of the Judicial and Allied Workers Union for an immediate statement and statement. Then you also have Women of Excellence.
Good morning, Honorable Minister of Health, Dr. Stalin. My name is Peter Mwari, the President of the Judicial and Allied Workers Union. Honorable Minister, we are joining the fight against COVID-19. On behalf of the unionized judicial workers, we've decided to, in our little way, donate 1,000 liters of fuel. As we understand that the frontline staff that are fighting the disease, they need logistics to move from one point to another. Our only hope, Honorable Minister, is that we only hope that the donation of given will be put to good use. That is what we are hoping. So this fuel is Honorable Minister. I have with me a receipt of payment at a filling station in Woodlands at the spectrum where we paid, so that we hand over to you so that we can continue using the same to ensure that our staff are well catered for the days of the festival.
I'd like to thank the Judicial and Allied Workers Union of Zambia, and as you know, that from the Judicial, the donation comes in the morning. That will jail you if you don't get it. We hear you.
Thank you so much, Judicial and Allied Workers Union of Zambia. That's generous support. So now call upon Women of Excellence, and I will request that Patrick Moore answer.
My name is Pastor Anna Mono, and I'm coming from the Women of Excellence under the umbrella of First Christian Center International. Honorable Minister, we are joining the fight against COVID-19, and we found it very, very important for us as women in Christian utility to come and provide to the people of Zambia, those that are not able to get a mask. We've decided to come and donate through the Ministry of Health 70,000 Chitenge facial masks. These masks were made by the Women of Excellency who are in the branches of First Christian Center countrywide, and they personally made them within 2 weeks. The total amount, Honorable Minister, is 70,000 to the donation that we made to this state. The donation is laid out there for you to receive, and we want to believe, as women of excellence, we want to be sure and believe that as a Ministry of Health, you will put to good use the masks that we have donated. And as we pray, and as we wait upon the Lord to answer our call of healing, because it's only through the supernatural healing that we get off this COVID-19. We pray that while we do that, we also take an action to show you that we follow the health instructions and recommendations that you have put across for us to follow. Thank you very much, Minister.
Thank you so much. That was Women of Excellence. May I now call upon Patrick.
Thank you very much. Honorable Minister, members of the dignitary table, press members, countrymen and women, I express my greetings. My name is Patrick Mali. It is particular an honor for me to have the privilege to speak in your midst. To that, I express my heartfelt gratitude. I am a 19-year-old youth, a student of the DON Entrepreneurship Institute, and a Zambia citizen. I'm passionate about entrepreneurship, innovation, problem solving, and I aspire to make a difference. Saddened by the negative impact caused by COVID-19 and inspired by the efficient measures put in place by your ministry, I decided to use my innovation and make face shields. The making of the face shields has been made possible with the great assistance from my young brother, Richard Mali, who has accompanied me here, and a friend of mine, Harrison Zulu, who has joined me as well. I today willingly make a donation of 80 face shields, equivalent to 750 kwacha. This is so because this battle is for all of us, young or old, and we as the young people will march and fight with you. We are our brother's keeper, and with unity we stand as one Zambia, one nation.
Thank you so much. That was Patrick Mali, and we appreciate the generous support for the pact. Lastly, I'll call upon the representative of First Funds and Minerals to come and give a short statement and say that they are making towards the public sector.
Minister, it gives me great pleasure to inform you that First Fund of Minerals Limited has taken extensive measures across the business to help protect its people and the communities around
these are the pandemic spread in line with guidance and directives from government, especially through you, and advice from international health organizations and best practice. The mining firm has provided financial support to the Zambian government to combat further spread of the virus. 2.78 million was contributed towards COVID-19 fight. In addition, the following has been spent on infrastructure development. 2.8 million on the provision of medical logistics support, 620,000 kwacha worth of supplies donated to Karumbila District Hospital. Then there's the renovation of Soleti Nurses' home as an isolation facility at a cost of $85,298 for that purpose. Honourable Minister, the purpose we are here today is to inform you that First Quantum Minerals employees at Sentinel Karumbila Mine have joined their employer in making a donation on a personal basis to government for today of 2,000 masks with the help to help with the fight of the virus. I'm happy to mention that a further donation of the masks will be made later on by the consumption line. And as I heard from the young man, these masks at the mine are being made by the women. The first masks are intended for use by your medical staff at Chilenje, Lady Manawata, and the UTH hospitals. Honourable Minister, one matter of concern to us is the protection of relatives of patients, now hospitals, who are required to be at the bedside. We request that this donation from our employees be made available to these caregivers, especially those coming from poor communities and backgrounds. We wish that they will not be turned away from being at the bedside of their sick relatives on account of not having a face mask. Admittedly, this is a small token, but it is the wish of our employees at the Karumbila Mines Limited to join hands with the government at this hour of need. I am pleased to hand over this donation on behalf of our Karumbila Minerals employees, whom First Quantum Minerals is truly very proud of. Thank you, Honourable Honorable Minister. Where are the boxes are empty? The ladies. Oh, yeah. Okay. Thanks very much, Honorable Minister.
Thank you so much.
That was General Chimbuli. That was the last decision, Minister. I call upon you to conclude the Honorable Minister.
Well, challenging times require unique solutions. Times of adversity summon us to the imperative of innovation. Patrick Mwale is one such innovator who has come on board with a unique product, and this must be commended. And this is the attitude we need to see in our youths, and this is what we need to promote as we pursue technology as an important anchor of development in the country. This must be applauded. Patrick must be appreciated once again. We encourage all the youths to emulate. Patrick, well done. The Judicial and Allied Workers Union of Zambia, we thank you very much for standing in solidarity with the people of Zambia. Fuel is a key component, of the logistics that we require for the response. This will certainly ease the operations of key people in the response. So we thank you sincerely, and this is a very high impact donation, and we place on record our gratitude. Thank you for standing in solidarity. Women in Excellency, our mothers, as we continue appreciating you as our Mother's Day of yesterday, we thank you again for coming out strongly to be our mothers. Your donation of masks will save lives. There are many out there in the community who will not procure the surgical mask, but who will be able to reuse, wash that cloth mask. And that way you'll be saving thousands, if not millions of lives. So we appreciate the Women in Excellency for your innovation, for your generosity, and for the support that you've given to the response. We thank you most sincerely and encourage other women groupings to do the same. And if we do that, the vulnerable person out there shall be in a mask. And if all of us are masked up, that will be a very significant step in fighting COVID-19. FQM remains a strategic ally of government in the fight against disease, and we thank you for what you're doing in Northwestern Province and countrywide, and we want to appreciate your support in the COVID-19 response, and urge other corporates to benchmark your conduct. So, as we conclude, Nakonde operation ongoing. All the samples being processed, and the samples that have been processed at a TDRC, including the samples from Nakonde and the Copper Belt and Northwestern Province, all of them will be validated, a very important step in science. And so as the processing is continuing, the validation is continuing, and we shall announce all the results for these cases. We urge the media to work with us to ensure that only the legitimate platform where information is released is utilized. And so we urge patience, we urge professionalism, we urge utmost adherence to our ethics, and ensure that when you see things like surveillance, that is routine, it happens every day. And if we're not reporting on any particular activity, it's not being hidden. It means maybe it's part of the process. And as we conclude, we will report on it. So Nakonde is being watched carefully, activities taking place, the border being disinfected, staff being trained and retrained, PPEs being reinforced there, and disinfection of other public places, quarantine taking place, management of cases in Nakonde and Chisali, where we've even introduced laboratory capacity, and we continue to work with other stakeholders in country and cross-border to ensure that we fight COVID-19 well. So we will get back to you with an update, and we will continue processing all the samples from Nakonde, the Copperbelt and Northwestern from TDRC, validate them, and come and present them to you. Lusaka province, out of 256 cases, samples, none positive. And as we speak, we remain with 117 recoveries. We remain with 7 deaths and a cumulative of 267 cases. Thank you, and see you next time.
Just